And to understand addiction, you have to know that addiction is a brain disease. It's a brain disease that crosses physiologic, body, physical stuff, psychological, psychiatric stuff, spiritual stuff, and it mashes it together into some ocean of despair. Hello, my name is Dr. Mario Sanbartolome. I'm an addiction medicine specialist and family medicine doctor, and I want to introduce to you a new series around substance use disorders that I think is very important for anybody to know about, whether you are an adolescent, a parent, somebody that's a professional and concerned about your employees, and maybe even someone that's a legislator making decisions. All of these topics that we'll be covering in the series are important for you to know, because our country now and the world at large really is faced with an epidemic that really requires all of our attention and all of our effort, and that is addiction. Addiction is not a disease of an opioid or of alcohol. It is a disease of the brain, and as we know, people will be using multiple substances at different times. If you went to a doctor's office and you had diabetes, the expectation would never be, hey, give me some insulin, thank you, I'm done. It would never be that, ever. If you're a Medicaid beneficiary, you are almost twice as likely to receive a prescription for an opioid. If your grandpa breaks his hip for the second time, don't ask, how do I fix the hip? Say, why is he falling? And is it the vodka at night? Is it the sedative he's using to go to sleep each night? You get to identify, oh yeah, that is my family and my friends and my pastor and my teacher, and any one of them could have the disease of addiction. We'll be talking about some of it, specifically about certain substances like opioids and alcohol and benzodiazepines, which are sedatives. But we'll also be talking about some of the aspects that sometimes people don't think about, like the role of depression and bipolar disorder or anxiety disorders, and maybe coping with the traumas of life. So everyone should be able to relate to this, and I hope that you subscribe and do your best to try to figure out not only how it affects you, but how you can affect our own society as it tries to understand the plight of somebody with an addictive disorder and how it affects a family. This is not about, hey, I'm going to watch you so you don't ever use cocaine or you don't ever do this. It's quality of life. And at the end of the day, quality of life for when I'm talking to my families and my patients, what I'm saying to them is it's not something I'm probably going to measure, but it's going to end up being, are you at a place in life where you can love and be loved?